Bacon,
Yo,
I got a question for you.
what's that, bro? What's that?
What's sex? What about sex?
What about sex?
What about sexual health?
What about it?
What about having your pee-pee healthy?
That's interesting.
What do we hit, Linda? It's another day. We're here to have fun. Abiertos is bringing you the love, but you know what? It's not about me. It's not about you. It's about that special spot. Some call it your papaya. Some call it your guava. And some call it, I'm sorry, but I got to do this just because I can. I have to bring him in, not because I want to, but because I need to. Yo, it's one of those days. That's all I'm telling you. It's one of those days.
Looks like Mother single time you play that.
I'm ready to sing that song. I'm ready to sing that song. However, we've got a person here with us. We got a guest today, Bacon, that I know you got excited when I talked to you about her. You got excited, and when I sent you her image, you were like, "Oh, Dios mío! Oh my God! Oh my God!"
Wow.
But I think you're more impressed in what she knows.
Wow.
I think you're very impressed in what she knows, because when we were talking off air, you and I, about her, and it is a her today, guys. You looked at me, you're like,
Right?
She can tell me about what? So let's not talk anymore. Let's bring her in. Her name is Stephanie. She is the host of, what's it called, Stephanie?
Podcast.
Hey, go. Yeah, look at his face. Look at his face. Between the sheets. Making a babies. Making a babies. Ay, mama. So, she's here to teach us how to make babies. I'm kidding.
There's more than one way.
You see, Bacon. I told you, you can't just flip a flapjack one way.
You didn't tell me that. You did not tell me that.
So, Stephanie, how are you? Welcome into Abiertos. As you can see, we're a little bit unhinged some days.
I love it. Thank you for having me. It's great to be here.
Definitely. We're looking forward to this conversation. So, why this topic? Why have you there? Like, literally, you know when a diver decides to just go and they go head first and they get that perfect no splash, no nothing? That's you right about now.
Oh, well, thank you. Yeah, sexual health is so exciting because it's something that, especially in the United States, we just don't talk about enough. And there's this shame associated with it. And there's kind of like this hush hush, like even conversations between your best friends are like, oh, well, don't talk about that, And so it's really nice to just, like you guys, open conversations, open up the doors, talk about all of it, get it out there. Some of it might be weird for you, but not for somebody else. And that's okay. That's what's so fantastic about the whole world of sexual health is there's a little bit for everybody.
You hear that, Bacon? A little bit for everybody.
That's right.
It's the smile getting me right now. That's what it is. The smile, right? You know what I mean?
I call it my $10,000 smile because it did cost about that much.
That's like $1 million smile right now.
Well, thank you.
Well, now, damn. All right, there's so many things you can do with 10 grand, but I mean, if that's what you wanted, Bacon approves. Bacon approves.
Very good. Straight up, 100%.
Yeah.
So, I get what you're saying, and it's all, taboo. A lot of it is taboo.
Yeah.
And a lot of it is, I don't know why people are so scared to be so open about it.
Yeah, I don't either. I think a lot of it comes from like the purity culture and a lot of religious backgrounds that people were raised where we just don't, the abstinence until marriage kind of phenomenon that was there for so long. And obviously none of the three of us believe in that. But I think, a vast majority of the population grew up like that. And so
Yes.
it's very difficult to break those barriers and make it not only acceptable, but fun to talk about.
Yes. See what I'm telling you? And then I get HR calls every day at work. Like, come on.
Yeah, see, that's why I work in urology as my day job as a nurse practitioner, and it's really the only place that I could work because the things that come out of my mouth would get me in HR on a daily basis in any other type of job.
I took the wrong career choice. Apparently.
Okay.
Think about it, Bacon. She's in the perfect spot. She can talk about what she wants. She can say whatever she needs, and there ain't nobody gonna say nothing back. Are you allowed to do that at work?
Yeah, pretty much.
See? I'm going back to school.
It opens the door. In fact, in all of my rooms, I have big pictures of erections and things like that because I want my patients to open up to me. I see men and women, and the women are a little bit easier with me. I am a woman, so they talk to me a little bit more. They'll open up a little bit more. But some of the guys need a little bit of a push to tell me about things. I know, for a lot of guys, ED is very common. Let's just talk about that. It's very common. It shouldn't be something that talk about. There are things that we can help.
We lost your mic a little bit there.
Now, you good?
No,
I'm
we're
not
here.
sure.
Here we go.
Oh.
I don't know. Yeah,
I don't know what I did.
electronics. Gotta love them.
That's right. So a lot of guys are a little bit ashamed of the ED and things like that. So I have a big poster in my wall and the guys will point at it and be like, can we talk about that? I'm like, hell yeah, we can. We love that. Like, that's all we're trying to do here. Like we need to talk about this and to bust these barriers and let's talk about it.
Bacon, I'm telling you now, we're going to have her back to talk about ED. A whole episode about ED.
Yeah.
Sure.
We need to get it out there, bro. We need to make men feel so uncomfortable that they call and be like, yo, Nurse Stephanie, hot problem? Yo, if you get ED, you got ED. If you don't, you don't.
Right.
If you need to be called, if you're the 1 minute man, make that minute count.
That's right. That's right.
It's not.
And we got things to help you last longer. It's fine.
Straight. That's funny.
Yo.
I love that.
Think about it. Why? This is one thing I always say. And Bacon, you agree with me on this because we've talked about this. Don't hide who you are and don't hide what's going on. There's ways to fix things. And if you're not looking for it, you're your own problem.
Yep.
I love that. 100% agree.
Very true.
So with everything you do and everything you've learned, what has been your most awkward moment?
Ooh, what a great question. I think it's I would say doing a prostate exam on a trans patient. The first time I had to do that was very awkward, but she was lovely, and we were both awkward about it. We got through it, and now she sees me every year, and we're good. We don't have any awkwardness anymore. But I don't know if you guys know this, but even if you do get bottom surgery as a trans patient, your prostate is still left there. So as a man, you are still, born male, you are still able to have prostate cancer later in life. And so it is something that we need to take seriously when you come into the office. So that was a little awkward for me at first. But now I'm good. Now I got that. And I would say like sexual health wise, I think the first time that a young guy came in and as I'm doing my exam, he had an erection. That's kind of like takes you back for a second and you're like, oh man, like, what am I supposed to do with this? Like, do I pretend it's not there? He knows it's there. I know it's there. Like, but you just kind of figure out like, it's a body function. He can't help it. 23-year-olds, you guys remember the wind blows and you get an erection, like.
With a smile on, we say yes to that.
Yeah.
So when you get an older guy, and I have to ask this because you're the perfect person to ask, when guys are in their 60s, 70s, 80s, we should still get checked.
Absolutely. Absolutely. Yeah, you want to get checked for your prostate health for sure. We're not so much worried about testicular health anymore at that point. Testicular cancer is really more of a young man's disease. But we still want to know that everything works well. We want you coming in once a year. A lot of guys develop urinary issues later in life because of the enlarged prostate, and we can help with that. And if you're not getting seen every year, who are you going to talk to when you aren't getting as good of erections or you're having difficulty achieving climax? Because I don't know if you guys know this, but prolonged ejaculation is a thing as you get older. Not for everybody, but for a large portion of men, it takes longer and more stimulation later in life than it did earlier. And we have ways that we can talk to you about that and help you with that.
Yeah, but wouldn't that be a good thing for her?
Sometimes, but sometimes we're ready for it to be done too, you know?
Yeah. So,
after 30 minutes, and you're just like, all right, man, I've already got mine. Like, let's move on here.
right from a woman's mouth, Bacon. That's it.
Yep.
We can't fight that one anymore. Them women saying 40 minutes, 4 hours.
They're liars. No, you know what? There's a little bit of everything for everybody. There are people who love long sessions, but the vast majority of people, that is not the case. Now, there is what's called the orgasm gap. I don't know if you guys are familiar with that.
Please explain.
Yeah. So men orgasm more often and faster than women in general. So for men to get turned on and get to climax generally takes about 5 to 7 minutes. That's the average, 5 to 7 minutes. For women, it's 14 to 21 minutes. So that's where all of the foreplay and the getting turned on and the arousal becomes so important, especially for a female partner, because otherwise, if you're done at 5 to 7 minutes, which is totally normal and fine, and she's barely started to get turned on, there's that gap, right? And the other cool stat, well, not really cool for women, but interesting, that they did was 85% of women on like a one night stand or first time with a new partner will not orgasm. 95% of men will. So that shows you just how much difference there is in men. You guys are so good at being in the moment, right? Enjoy it for what it is, get that pleasure. Women, we're so much in our heads. So we're thinking about other things, and we really have to be mindful and focused and get into it. And if I don't know you very well, or you don't know my body very well yet, and things like that, probably not going to get there.
That's true.
Yeah.
Bacon
so
stuff having 1%.
Yeah, so that's the orgasm gap. Men can orgasm faster and more often than women.
See, Bacon, 2 for 1.
Oh. But I guess whatever works, right?
Hey, whatever's gonna make her happy, that's your job to accomplish.
Oh, of course.
Yes.
Yeah, because I find myself to be I like the pleasing aspect. We'll do my thing and everything else before we get into the intimate part of it. So that does make sense about the foreplay and everything.
Yeah.
I find that very important because I kind of figured that. Well, I'm just basing it off the relationships I've had in the past where I've been with women who've came faster than others,
Yeah.
and some that haven't came at all. So that's a good point that you made to clarify that, because I've always wondered why that was, and thinking, yeah, maybe it's my fault, but it's like you said, like the 14 to 21 minutes makes a lot of sense. So yeah, foreplay does matter, and how you do your thing, as they'll say.
Yeah,
you know what I mean?
absolutely. And the only time it's your fault is if you're not listening to her and doing what she wants you to do.
That's why I like to questions. Yep.
So, fellas, no matter what, it's your fault.
Always.
Oh.
No. And, that's the other thing with erections, too. I have men that come in and their wives are just so distraught because they think that losing the erection is because of them. Oh, he's not attracted to me anymore, anything. So it's the same. Whereas women need longer to get to orgasm, and that has nothing to do with who our partner is. men who have difficulty with erections, it doesn't matter who your partner. No, let me caveat that. There are some times where it matters who your partner is. But for the majority it doesn't really matter who your partner is. It's you. Are you in the moment? Is your body functioning correctly and all of that? So it really is important to have those open conversations and say, hey, listen, I was really stressed out at work today. I'm sorry I lost my erection, but it is not about you, or from her perspective, like, hey, I really enjoyed our time tonight. What you were doing at the beginning with that finger and the way that it was rolling, that's what I need you to do more of, or whatever. So being open is super important and having those conversations. And I find that even couples who have been together for a long time and should be very open with each other aren't. And it's such a barrier to them having a better sex life.
Yeah.
So would you go ahead?
I want to. This is one of the questions I wanted to ask. Of the guys that have come to see you, have they maybe talked to you about like if they're about their weight and if how weight affects, I guess.
Yeah, absolutely. So like weight not only affects your penis size, okay? Because the bigger you are, the more your penis gets pulled inside of you. And so there is actually a statistic out there. I think it's for every 50 pounds you lose, you gain like a quarter or a half an inch back of your penis. And we actually have surgeries that are called buried penis surgeries for guys that have gained weight to the point where their penis is kind of an innie, not an outie anymore. And we can go in and remove the fat pad around their penis and kind of reconstruct their penis for them so that they can use it again. So weight really does matter. It also has an effect on your testosterone levels. It has an effect on your libido and your energy and your stamina, all of these things. So if you can exercise regularly, eat a good diet, get good quality sleep, which very few of us are good at that. Those are the ways that you're going to have the best sexual health. The other thing that I think is really interesting, and I did not realize how connected this was until I got into urology, is that erectile dysfunction is a huge indicator of cardiovascular health. So if your blood is flowing correctly, you've got good cholesterol, all of those things are in line, you're not having ED. If you're having ED, you've got some type of a blood flow compromise, whether it's because of high blood pressure, high cholesterol, maybe you have some diabetes going on, different things like that. But if you're a young man, especially, and you're having true ED, you need to get a cardiovascular workup because there might be something bigger going on.
Interesting.
Yeah.
Because for me, it's like I'm 47 and I've lost over 100 pounds like 6 years ago.
Congrats.
And then gained it back. So yeah, it's one of those where I felt the difference when I was at those weights. So that's always been a question of mine. Does weight actually affect that? And parts of what you're saying I've heard. So you just solidified what I've already known and what I'm taking into account now because I'm back in the gym trying to lose weight again and stuff like that. So yeah, that makes a lot of sense. So
yeah, it's really important. And also sleep apnea for guys that have, snoring and they kind of close off at night while they're sleeping. If they're not wearing their CPAP, that also decreases testosterone. And so that can have an effect on your erections as well. So not only do you need good, 6 to 8 hours of quality sleep, but you need to be breathing correctly while you're sleeping too. And so that is really important.
Yeah. Wow.
Lots of connections in our body.
Yeah, like I've always known that, but just those things I've just always wanted to know. So thank you for clarifying that for me. Yeah. Definitely.
See, I told you we'd get the right people in here to tell us the right things.
Hey, of course, that's it. That's what I was looking forward to this episode.
It's all about learning.
That's it.
Hey. Okay, so I'm gonna ask, is that your puppy?
This is my puppy. This is Milo. Come here. He just got snuggled in, but this is Milo.
Oh, he's so cute.
What?
He always sits with me when I record.
Nice.
Yeah.
Over here.
Here comes the drool bag. Here she comes. Where is he?
They're chilling.
Oh, they're chilling today?
They're sitting right beside me at the chair, just playing with their toys.
They're learning. They're learning. He's got two. I wish I was allowed to have one, but I'm not.
Oh, yeah.
I work way too much and I spend too much in the studio. That's another story. So Going back to you, what brought you to want to get into this career?
I hated the job I was in. That's about as simple as it gets.
Wait a second. So you hated it, whatever you were doing, to go put your finger in a butthole?
Yep. I know, that's pretty crazy, isn't it? No, I hadn't found my niche yet as a nurse practitioner. And I had tried internal medicine, I had tried pain management, and I just wasn't feeling fulfilled. And one of my friends worked for the urology company where I now work and was like, Steph, we have a position open. Like, you've got to apply. It's so your personality. You're going to love it. And I was like, well, what do I have to lose? I already don't like the job I'm in, so might as well try it. And it is absolutely my jam. There are aspects of urology that are not my favorite. For example, kidney stones, it's just not my thing. I do them. They're great. Like I know how to do it, but it's just, I really like the sexual side of things and helping people improve their relationships, their personal satisfaction in life, and just being able to do that. There's so many things that get in the way of us having good sex, and sex is so important to our overall health.
Indeed.
Yeah.
Indeed.
Yeah.
Yes, I think every normal human being agrees with you on that.
Yeah.
Oh, yeah.
Yes. Yes,
So-
there's lots of studies out there too that say, how orgasms not only decrease stress, but they improve your mental health and your physical health. For men, here's a fun fact for you that you can use with your buddies. There's a study out that says men that ejaculate 21 times a month have a 20% lower risk of prostate cancer than men who only ejaculate 7 times in a month. So now you have homework.
Bacon,
What?
21 days per month. You know what you need to do, my brother.
That's right. Knock it out of the park.
Yeah, I guess you do too, my friend.
And you know what I say to that? I'll see you at 22.
Yes.
Listen, one of the biggest reasons why I'm such an advocate about this, and I'm not scared to talk about it, I was 19 years old, and my boss at the time came to work one day almost in tears. He could barely walk. Apparently they were putting, and this is going to sound disgusting to guys, but it's true. If you don't take care of your prostate, you don't take care of your little friend there, you're going to be in trouble. So what he was telling me is that they put, here, I'm going to grab something. They would put a brush, like a bottle brush, into that little pee hole to be able to scrape things out for the man to be able to pee.
Yeah.
When I saw him in that much pain, I said to him, "What's wrong?" He started laughing. So I asked one of his kids, his daughter, to be honest. I'm like, "What's your dad going through? Like, seriously?" He's like, he's having problems. It finally came out, and it got me worried. Because I'm like, yeah, I'm 19 years old, but you know what? I know that's an outie, not an innie. No.
Yeah.
No. So I don't care. The world can get mad. The world can think what they want. But you know what, fellas? Take care of yourselves.
Yeah.
Because you don't want a baby bottle brush going in your pacifier, for lack of better words, right now.
That's right.
But definitely, y'all don't want things going the wrong way, because seeing a strong man fully, like this guy was built like a brick house, solid man, ate healthy, ate everything, but
Just take care of yourself.
don't know, coffee constantly, drinking things he shouldn't have been drinking, even though he was healthy, because he was healthy. And he had his kids, and that was it. There was no more that activity. There's no sex. There's no nothing. I'm like, dude, your wife is gorgeous. Like, what's wrong with you? He kind of told me off of that day, but yeah, no, you have to take care of that. Listen, I'd rather, like I said to my little brother one day, I'd rather go bald, lose my teeth. I ain't going through that pain.
Yeah.
That part of my body needs to be loved and cared and treasured. And if it isn't, well, then you know what? I'm going to go buy a bottle of something to help myself take care of things, because it ain't going to happen. No. So
I unfortunately had to go through a scenario. No, like I'm making this out there. I'm putting myself out there doing this.
yeah.
I actually had my circumcision done, I think 1.5 years, 2 years ago.
Okay.
I was developing what the doctor's saying, a yeast infection, which I had no idea that men can get.
Yeah.
No idea. And because when I shower, like, I take 2 showers a day and I try to keep myself clean because I am a bigger person. So, but it was getting to the point where it was starting, my foreskin was starting to close up, and I couldn't retract back the skin. So when I went to my doctor, yes, because I tried it once and it was almost like my dick was in a headlock, and didn't want to. Didn't. Yeah, it was. I wouldn't wish that pain on anybody. So when I went to the doctor, he's like, "Yeah, it's you got an infection." So he gave me some antibiotics, and he goes, "When it goes down, you have two things you can do. Either one, if you're at home with your girlfriend or you're by yourself, and you just take your time and pull back on the skin till it gets back to regular size and is able to reform out, or you get to talk about getting a circumcision." So looked into it, how the difference was between at the time when I got it from not getting when I was younger, same procedure. So I went and got it done, and 100,000 times better. Yeah.
Yeah. Well, and the interesting thing is, had you not, you have the risk of having that repeated multiple times throughout the rest of your life with that infection, because it happens all the time. I mean, we do circumcisions on men, not only your age, but in their 60s and 70s and 80s, because it becomes such an issue and it's extremely painful.
Yeah. So that was when I went through that, I was like, wow, like, like when I even the procedure, I was just thinking to myself, I'm like, how did I get to this point? And I'm thinking to myself, I'm doing something wrong or something, but no, it's just
yeah, you can be the cleanest person, and if your body is the body that is going to grow extra yeast, then there's nothing you can do about it.
Right. So I was just like, but yeah, after that, it's just like, now I'm losing back my weight, so it's easier for me to clean myself while I'm showering and stuff. So it's a lot better and a lot more sensitive. When the skin came off, it was just like, fuck, anything touched it. Jesus Christ. Woo.
Yep.
Yeah. So it's there. Yep.
Yep.
So yeah, it's one of those type of feelings. But yeah, like I would highly recommend if men look after yourselves, because like I said, I had no idea that men can have yeast infections, and women can only have it. So it's just like, whoa. So when I was like, what? No.
Remember, the only thing that women can have that we can't have is a baby.
Right?
Yeah.
Everything else they get at some point, somehow. If we're meant to have it, we're gonna have it.
Right.
So because of experience that happened not long ago, Bacon, our last live. You remember what we talked about? What I opened up about?
In regards to you're surprised.
Stephanie, you need to watch that last live we did.
Okay.
I'll send you the link and you'll understand more.
Okay.
But I'm going to give you a bit of information. Actually, I'm going to ask you a question.
Okay.
Is it common for women to have aroma down there, if you know what I mean?
Yeah. So a nice bland aroma is normal. Fishy is not normal. Lead type, like a metallic, is not normal. But yeah, there's a light aroma for most women.
I told you it wasn't normal, and I'm glad I ran away.
You had every right to run away.
Yeah. So the biggest reason that women will get that like really fishy, where the tuna smell is bacterial vaginosis. Very, very common in any woman who's sexually active, but it needs to get treated because it will fester if it doesn't. And it's just an overgrowth of your own bacteria. The pH gets off for whatever reason, and it overgrows. Week of antibiotics, you're good to go. But yeah, it needs to be taken care of, and nobody wants to be down there during that time.
So if this person is actually watching this, now you know. Now you know what you need to do, and I understand why. Now you understand why you ran away. Oh, trust me, if you get the chance to watch the episode,
I will.
Please do.
You will enjoy and understand why I'm feeling the way I'm feeling right about now.
Yeah.
So, all that to say,
Mhm.
and since he brought the whole yeast infection, is it true and is it common that every time a female switches partners and has a long-term partner, she can get a yeast infection from that?
Nope. Not at all.
So could it
No.
be
So
because,
go ahead.
could it be because of multiple partners?
No, I mean, yeast really shouldn't grow up for having multiple partners or anything like that. Yeast is really an overgrowth of the lactobacillus that we have in our vagina. Usually it is because the woman used a product in her vaginal area that threw off her pH. So a lotion, a douche, a soap, anything like that kind of throws the pH off down there. That's when the yeast is going to proliferate. Where you're seeing women with infections and odors and things like that from multiple partners, that's more the bacterial vaginosis with the fishy smell, or chlamydia, gonorrhea, one of the STDs.
Damn.
Mm-hmm. Yeah.
Interesting.
Mm-hmm.
Bacon, say no to fish. Sorry, we have an ongoing thing here that we say ties are the best. Say no to this.
Yeah.
Certain comments that we'll just drop at each other. That's why he knows where I'm going with this. So, being that you enjoy all of this, being that you've actually are making a career in all of this, how hard is it for your family members, knowing all that you do, for you to come around and you'll be like, boom, comment, or for them to come up and say, hey, Steph, Auntie Steph, or cousin, or how did that come around?
Yeah, so my parents are very supportive of what I do, but they don't listen to most of my podcasts. They will listen to certain ones, but not all of them. And I'm very careful when I tell certain stories to make sure that they do not come across as personal stories. So that they're just like, hey, I have this friend who... But I would say for the vast majority, my friends and my son is 16. He helps me edit my podcast, and all of his buddies get a kick out of coming over. Miss Steph, what's the biggest one you've ever seen? Miss Steph, is it really like in pornos and like all this? Like, so they all love getting to ask me questions and, having somebody that they can actually open up to. I mean, especially the teenagers, they don't have someone who gives them quality education, right? They learn it from each other. They learn it from porn, which, I mean, when we all grew up, porn was magazines and maybe a VHS tape and pay-per-view. Like now it's on their cell phones. It's on, flipping Instagram, you're seeing boobs and butts in your face. My Instagram goes into jail all the time because I do sexual education, but these boobs and tits are in my face all the time.
Oh my God.
Wow.
Yeah, my family is very supportive. They just pick and choose which of my episodes they listen to. I did have fun when I first got into urology, and my parents would come visit and sitting at the dinner table and kind of telling stories from work and see how long it would take my dad to get up and leave the table.
Wow.
It was kind of fun. Yeah.
Oh man.
Yeah.
I like how you say that and smile, like there was a little bit of intent behind that.
Oh, for sure. Yeah. Absolutely.
That's awesome. That's freaking awesome. Bacon, imagine you're sitting down at the table and your little sister turns around. So I saw a penis that looked like this today.
Yo,
Yep.
my granny, if my granny was alive, she'd be like, yo, you haven't seen nothing. What are you talking about?
That's right. So true.
Yeah, grandma not be having that at her table. Sorry.
That's right. Grandma would be like, I could teach you a few things.
Honestly, yeah. Listen, I love my grandmother. She passed away a few years ago. However, one of my lasting memories with her, she is on her deathbed and is built, I think he was either Jamaican or Trini. He's like full muscular, like ripped to the nines. And my grandma's looking at him, and she looks at me and says, what's this fucker here for? I'm like, he's here to give you your daily sponge bath. Grabs his hand on her deathbed, 88 years old, grabs her hand. It's like, no. No, more down, more down. And
Yes,
he's like,
Grandma.
oh yeah. She looks at him and it's like he's literally looking at her. But mama, no, mama, mamacita, go. Don't
Yeah.
worry about it.
Yeah.
My grandmother was a firecracker to the day she died. She didn't. I literally went up to her one day. I'm like, listen, I'm having a problem. She's like, do you need condoms? I'm like, what are you talking? She's like, you need condoms. At your age, you need condoms. I'm like, I'm a virgin. She's like, don't freaking lie to me because I know you.
Yeah.
Yeah. Yeah, that's the type. And someone's grandma was a little bit the same. So gotta love it. You know what? I believe it's better to have an open communication like that with the kids.
It is.
If you hide it from them, if you don't give them the opportunity, why? Like even when my daughter, and this is gonna sound like hell. When my daughter came out, she said to me, Dad, I'm by. I'm like, yo, when we picking up girls?
Yeah.
Yeah, you gotta be open.
Yeah. Absolutely.
So-
When my kids were starting to date and things like that, I was like, all right, I have a daughter and a son, and I was like, all right, do we need birth control? Do we need condoms? Whatever. Because they're going to do it, whether you tell them to or not to, or they're going to. And so if you provide ways for them to do it in a safe way, if you provide an open communication for them to say, Mom, this really weird thing happened, or I don't know what this means, or whatever, then they can talk to you and you don't judge them because we all do it too,
Yes. No, I actually, have you ever seen any of the videos or any of the documentaries with Sex with Sue?
Yes.
Okay, she came to my school, my high school. I kid you not.
Okay.
And you know how she would put the condom over her head and blow it?
Yeah.
So when my girls were of age, I put a condom on my head. And they're looking at me, what are you doing? I'm like, and I start blowing and blowing. I'm like, if he says he doesn't fit.
Yep. I did a similar thing. I put it all the way down my arm. And I said, if he ever tells you he doesn't fit, he's lying.
Yeah. You see bacon
in all different sizes.
Mm-hmm. From I can barely see it to what the hell is that?
Yep.
It's true. Why lie?
It is.
Why lie?
It is. And let's be honest. Let's talk about size. Size in general doesn't matter, right? Because again, it's how you're using it. It's how aroused did you get your partner. It's, most women, if we're talking about heterosexual relationships, most women don't orgasm from penetration. So it's all of the other parts that matter the most to the female partner. And then, go ahead and have fun and knock it out of the park. But if you didn't do the rest of it first or after, then you're going to miss the mark with her. And so size matters to some degree. Yes, I want to feel it when it's inside of me and I don't want it falling out. But other than that, there's also a point where women a lot of times don't want one that's ginormous either because it can be painful.
Yep.
And I know some guys who struggle with the size because then they just can't be as free to, penetrate wildly or whatever they want to do because they are concerned about hurting their partner and they can only go in so far. And so, I joke around with the young guys when they come over and they're talking to me about size and stuff. And I'll just joke with them about, oh, you guys, you want the biggest one, whatever. And they know I'm joking because I don't really believe that. I think, the average is 5 to 7 inches. I think that's beautiful.
See, Bacon, you're beautiful.
Of course. Of course.
Yeah.
Of course.
I have seen a micro penis. That was very interesting when I first saw that. It was a little nub and I felt bad for him, but he had a wife. It was a little nub. But he and his wife had been able to have a baby and they, again, you find other ways of intimacy. Penetration isn't the end all be all.
There you go, ladies. There you go. From a professional, somebody who knows what she's talking about, somebody that clearly has a very good understanding of all of this, turns around and told you guys. Doesn't matter if it's King Kong or you've got little Bo Beep in the corner.
That's right.
Yeah, I can't believe she said it now. Oh my god.
Hey, that's why we're Abiertos, bro. We gotta keep it
pretty
open.
accurate description.
Yo.
Crazy.
You know what? Some people don't understand that. Some people think that, having this big, huge monster, you're all of a sudden King Dong. You
Right.
own the world. And you know what? Good for you for having that much confidence, but are you hurting her? Are
Right.
you understanding? Because you know what? I'm not going to say I'm one of those, thank God, because I enjoy myself and my partners have enjoyed me, thank God. But I actually dated a girl and she said to me, "You're normal." I'm like, "I hope so." And she told me about her experience with this guy, and she's like, "I couldn't. I couldn't. He didn't know what he was doing. It would hurt. I was constantly going to the hospital." I'm like, and me being me, obviously, I turn around and said to her, "Did he like impale you? Like, did he cut you? Did he like hurt you inside? Like, you have those questions."
Right.
And she just looked at me
Right.
and said, "Shut up and go to bed." I laughed at the situation, but then I'm like, wait a minute. Does this leave lasting effects? Like, does somebody hurting them inside, hurting a female that way inside, does that leave lasting effects? Or cutting your nails, like fellas, that can hurt them. Like, so my question is, somebody that doesn't understand how to use their member or has
Mhm.
nasty ass nails, do they leave painful long term hurt issues? Um,
Yeah, more so mentally than physically, right?
well,
Because
that's
even
what I mean.
if,
Like,
yeah, so like even if you get a scratch from a hangnail or something like that, that's going to heal. But mentally, if you're with someone in the future who is similar, let's say in size to that person, or maybe that person was a, I don't know, some type of mechanic that worked with their hands. They just had real rough hands. And now you're with another person who works in the trades who has rough hands. And you automatically go back and think about how that you got a UTI because that guy had dirty fingernails, or you got cut because he didn't cut his nails, or something like that. Yeah, automatically you're going to think about that. So there is some long-term trauma. If a guy just bears into you without any consideration of how that could make you feel inside, and especially if he's on the larger side, that can definitely leave some issues going forward. Now, hopefully, she has a loving partner in the future who will, work through that with her, and she can work through it herself. But absolutely, that can be an issue. Yeah. And
no,
I think
good to
that
know.
brings up a really good point too about how important it is to be talking to your partner about all of this, right? I mean, that's what it comes down to. Tell your partner good, bad, ugly of the past so that they don't make the same mistakes. And also, like, we shouldn't get so hung up on this is how I think we should have sex, and this is how I've had sex in the past, so this is how we are going to have sex, because everybody's different. So just because the way that you fingered or ate a girl in the past doesn't mean that the girl you're currently with likes it the same way. And you shouldn't be offended when she tries to show you what she likes. You should be like, sweet, you just gave me the textbook on how to get you off. That's awesome. And vice versa. If you get off on a certain way, or you want me to give you head in a certain way, you should be telling me that, because I want to please you just like you want to please me. And we shouldn't be ashamed to say, hey, that feels good, but I need this rhythm, or I need this depth, or I need, and that should be easy for us to talk about.
Thank you.
Stephanie, when are you putting out your book? I'm buying it for 1,000 different people.
That's to come.
And I'll buy the next stuff.
No pun intended, eh?
That's right. That's right.
So I see that you take a lot of happiness in all of this. So I also do a different podcast. It's called The Hot Seat, La Silla Caliente.
Okay.
I don't do this with everybody that comes on Abiertos, but I think you'd be a good candidate, and we're going to have fun with this. So we ask you questions at the end of La Silla Caliente. We ask you some questions, and it gets more intense as we move on.
Okay.
I think we should ask her 7 questions, Bacon. Do you want to start, or do you want me to start? No more than 7, though, because remember, we do have another guest coming up shortly. So
you start off and
chicken.
Yeah, I know. Yep. Yep.
Well, I know. Okay, Stephanie, you ready for this? You
I'm
get
ready.
one plead the fifth.
Okay.
Okay, everything else, don't think about it. Just answer whatever comes to your head.
Okay.
Okay.
Got it.
Stephanie's favorite place to make love?
Bent over in the kitchen.
I was banking on that. I was banking on that because my question I was going to ask was, what was her favorite position, and she answered that. She answered that in the first question. But I was thinking that, and I'm like, and I'll literally tell you what I was thinking. I'm like, in my head, I'm like, wow, she must like get bent over in the kitchen or something. 100%. I'm not even playing with you. Like, yeah, that's yeah. I'm gonna step back.
Stop drooling and ask your question, boy.
She kind of answered it already, but let me ask you this: what was the most awkward session, other than the one that you mentioned about the
trans?
The trans that you've had that clearly comes to your mind?
Yeah. I think there was one patient so there's something that we can do for erectile dysfunction called intracavernosal injections. So when Viagra and Cialis don't work anymore, we have injections we can teach you how to give right into your penis. Gives you a nice hard erection. They're fantastic, but you got to get past the fact that you're going to stick a needle in your penis, okay? But I had this guy come in, and it was right after COVID, so we were still kind of wearing masks. And he was like, I got down and I was teaching him how to do it and whatever. And then he pulled his mask down and was like, I could pay this back too. And went, blah, 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 blah. And like, I literally just stopped and I was like, I'm going to walk out of the room now. And I walked out and I got one of the male physicians and I was like, he was totally inappropriate. I'm not going back in there. And my docs that I work with are like, absolutely, we got your back. Like they would never let anybody be inappropriate with me. And so they went in and finished the appointment and that guy is not allowed to see me. But that was really, really inappropriate and awkward.
That's not called. Yeah. Wow.
Damn.
Yeah.
Wow.
It took me a little bit to recover from that one.
Yeah. Yeah. Wow. That's crazy.
Yeah. Professional boundaries. Some people need.
Yeah.
Yes. Oh my God. Yes.
Yeah.
Will you ever retire from this career?
Oh, great question. You know what I would love to do with this?
Would you ever retire from this?
I don't think so. I think what I would like to do is get more involved in it. My like 10, 20-year goal plan would be to be a speaker at sexual health events, to open a sexual health clinic that actually has the right people there. So we would have a sex therapist, we would have a pelvic floor specialist, we would have a urologist, a gynecologist, all the people that you need for an amazing sex life in one office. That's what I want to do.
I like that.
Yeah, that makes total sense. Total sense. Wow. I don't know what else to ask, honestly.
I'm ready.
You're nervous. She's making you nervous.
Huh. Interesting. Because she's so on top of everything. So it's like,
isn't that how it should be sometimes?
Right? It's always good to be on top.
That's right.
All right.
So you don't have any other questions? You're actually blanking out on me this time? Okay. So, one-word answers.
Okay.
Yes or no? Should men have toys?
Yes.
Should men learn or be taught how to use toys on their partner?
Be taught.
Learn, Bacon. I love putting him in the spot. Sorry. I think everybody's noticed that now. I'm only going to ask you one more question.
Okay.
Can we book you for another session?
I would love that. Yes, this was really fun.
Definitely, we enjoyed ourselves. I think Bacon's enjoyed himself a lot. This ties in just for everybody that's coming through. Make sure you follow Stephanie. Make sure you follow her links because we're going to be putting them up. Make sure you guys give her love wherever her podcast's at. And if you see her at some event, don't be shy. Go say hi, but don't touch. No touchy.
No touch.
Make sure you guys are nice. Make sure you're gentle. And more importantly, Yo, wash. That's like wash. That's all I can tell you guys. Wash. Use proper hygiene, my people. Like, that's a big thing. Stephanie, thank you for being here with us today. I really appreciate your presence, your knowledge, your openness, and your no fear take on sexual health.
Thank you so much for having me. It's been a pleasure.
Well, I think the pleasure somebody else is having it right now. He's got a huge smile on.
This was great. This was a lot of fun.
I'm taking a lot from this episode. So
Good.
I told you, we gotta learn.
Yeah.
I hope it was a notepad. You got to learn, dude. Like I told you, this is one of the biggest things I want for Abiertos is, yes, we're open, we speak a lot of things, and we speak a lot of smack, but we want everybody to learn and grow with us. Because the more we learn, the more we know, the more knowledge we have, the better we get at whatever it is we're doing. Even as a porn star, you're going to have to learn something.
That's right.
So we'll let Stephanie have her word, and we'll be right back with you guys.
Thanks so much for having me on and for listening. I am the host of the Between the Sheets podcast. So we'll have links for that in the show notes that you can go and listen to all of my sexual health topics with just myself sometimes and sometimes with guests. You can also find me as a nurse practitioner in urology with Chesapeake Urology in Columbia, Maryland.
I hope all of you who are listening in today and watching this episode learned something today, because our very good guest here definitely showed us a lot of different things that we can do to improve our sexual health. And yes, I know that's very important with me. So I learned something from this episode today, and I hope y'all learned something too. And also, believe in yourself, trust yourself, love yourself. Therefore, you can love others freely, if need be, or on a more intimate level. MC Bacon salute. You know what it is.
I love having fun. We love doing what we do. But more importantly, before we go, I want to tell you guys something. Get yourself checked out, fellas, because it's not just the ladies that need the attention. It's not just the ladies that should be running around after you. For you to get yourself checked. Get your little fella checked. If you need to get him trimmed, if you need to get him cleaned, if you need whatever it is, get yourself the love you need down there. Because the last thing you want to do is reach 45, 55, 65, 75, 105 and be walking like a penguin because you didn't take care of him. And when you're there with your lady, make sure you keep it between the sheets.